We are going to talk about subtypes of dementia. This is the last part of the subtypes of dementia. Alcoholism. Main article, alcohol-related dementia. Alcohol-related dementia, also called alcohol-related brain damage, occurs as a result of excessive use of alcohol, particularly as a substance abuse disorder. Different factors can be involved in this development, including thiamine deficiency and age vulnerability. A degree of brain damage is seen in more than 70% of those with alcohol use disorder. Brain regions affected are similar to those that are affected by aging and also by Alzheimer's disease. Regions showing loss of volume include the frontal, temporal, and parietal lobes, as well as the cerebellum, thalamus, and hippocampus. This loss can be more notable with greater cognitive impairments seen in those aged 65 years and older. Mixed. More than one type of dementia, known as mixed dementia, may exist together in about 10% of dementia cases. The most common type of mixed dementia is Alzheimer's disease and vascular dementia. This particular type of mixed dementia's main onsets are a mixture of old age, high blood pressure, and damage to blood vessels in the brain. Diagnosis of mixed dementia can be difficult, as often only one type will predominate. This makes the treatment of people with mixed dementia uncommon, with many people missing out on potentially helpful treatments. Mixed dementia can mean that symptoms onset earlier and worsen more quickly, since more parts of the brain will be affected. Other. Chronic inflammatory conditions that may affect the brain and cognition include Behçet's disease, multiple sclerosis, sarcoidosis, Sjögren syndrome, lupus, celiac disease, and non-celiac gluten sensitivity. These types of dementias can rapidly progress but usually have a good response to early treatment. This consists of immunomodulators or steroid administration, or in certain cases, the elimination of the causative agent. A 2019 review found no association between celiac disease and dementia overall, but a potential association with vascular dementia. A 2018 review found a link between celiac disease and non-celiac gluten sensitivity and cognitive impairment, and that celiac disease may be associated with Alzheimer's disease, vascular dementia, and frontotemporal dementia. A strict gluten-free diet started early may protect against dementia associated with gluten-related disorders. Cases of easily reversible dementia include hypothyroidism, vitamin B12 deficiency, Lyme disease, and neurosyphilis. For Lyme disease and neurosyphilis, testing should be done if risk factors are present. Because risk factors are often difficult to determine, testing for neurosyphilis and Lyme disease, as well as other mentioned factors, may be undertaken as a matter of course where dementia is suspected. So this is the other types of dementia, and we are going to talk about the last part. Many more medical and neurological conditions include dementia only late in the illness. For example, a proportion of patients with Parkinson's disease develop dementia, though widely varying figures are quoted for this proportion. When dementia occurs in Parkinson's disease, the underlying cause may be dementia with Lewy bodies or Alzheimer's disease, or both. Cognitive impairment also occurs in the Parkinson plus syndromes of progressive supranuclear palsy and corticobasal degeneration, and the same underlying pathology may cause the clinical symptoms of frontotemporal lobar degeneration. Although the acute porphyrias may cause episodes of confusion and psychiatric disturbance, dementia is a rare feature of these rare diseases. Limbic Predominant age-related TDP-43 encephalopathy, LATE or LATE, is a type of dementia that primarily affects people in their 80s or 90s and in which TDP-43 protein deposits in the limbic portion of the brain. Hereditary disorders that can also cause dementia include some metabolic disorders, lysosomal storage disorders, leukodystrophies, and spinocerebellar ataxias. So thank you very much. This is the last part of our class, and I think you have enjoyed listening to this video about the subtypes of dementia, and this is the last part. Thank you for the comments you have already given to my channel, and thank you for the likes you have shown to my channel, and once again thank you for subscribing to this channel. Thank you very much.